Good morning, everybody, and welcome to Tuesday Training. I hope you're having a fantastic week. As always,
we are live from Austin, Texas, right here at Insurance Syndicate headquarters, and man, we have a great show for you.
Good morning. What is happening, man? It's Tuesday. It is Tuesday, so you know what time it is. It's time for some Tuesday Training. If you were with me last week, I told you I was going to bring back the bundling worksheet today. So we are going to dive into bundling Medicare products in this show. I've talked about this before, how easy it really is to bundle, especially in a live setting when you're sitting across from someone. It'll be a little more difficult on the phone, but you can still do it. And I'm going to go through that. I have a worksheet that I use. Sometimes I just use my notepad to help me out. I'm going to go through my exact script on how I do that and how, whether they're buying Medicare Supplement or Medicare Advantage, I'm usually getting somewhere between 3 to even 6 apps in a sale. So we're going to talk about that today. I promise you it's a lot easier than it sounds. The hard part about it, again, is going to be in the telesales space when you're having to get them on the other side of the phone to write down the items that you would normally be writing down right in front of them or using the worksheet, right? So you'll have to practice with that a little bit. The other thing I would tell you when it comes to bundling is you got to be confident, man. You got to be confident in your own skill set to, one, create a healthcare package that is desirable, right? And understand that, hey, I am the licensed expert. There's a reason they're asking me is because they trust me. I'm the licensed expert. I'm the one that knows this stuff. So let me use my expertise to build a healthcare package for my client that they're going to appreciate, use, and can, most importantly, still afford. We're not trying to oversell, but we are trying to do our job as an agent by covering as much risk for our client as we can. We're going to dive into that. As always, this show is brought to you by DFY CRM, my CRM of choice. If you are, for some reason, still out there as an agent running on an Excel spreadsheet with no CRM, I would highly encourage you to change that. And if you need a CRM, check out DFY, man. The guys over there do a great job. It's got everything you need right out of the box. Just plug your assets in and you're good to go. With that said, I do have a little bit of news that we're going to jump in. I already put one of the articles that I'm going to go through, which is a report from Kaiser Family Foundation that talks about access to doctors, right, from traditional Medicare and Medicare Advantage. And they've cut it, they break it down pretty well. We're going to dive into that a little bit. But as always, I do talk about fraud. I don't have a new fraud case for you today, but what I do have is this little article right here. Let me put it up on screen from CMS talking about crushing fraud, waste, and abuse. And this goes through some, it's basically a summary of what they've been doing to crush fraud, waste, and abuse. And they talk about their accomplishments since January through August of this year. It says right here, CMS has imposed 315 Medicare payment suspensions on providers. Over $1.8 billion in payments are on hold following that provider suspension, right? Through medical reviews, CMS fraud contractors have identified $1.6 billion in overpayments across 2,241 Medicare providers. Wow. Automated edits guarding against improper payments and potential fraud have denied over 800,000 items and services totaling 141 million. Like, I'm not going to go through everything here, but it's basically a summary of everything they put together. They've collected over 250 million in overpayments through post-payment reviews. They've denied 77,000 Medicare claims for unnecessary items and services because they failed to satisfy Medicare's preliminary approval checks. Quite a bit. So I'll drop that in the group for you guys. Y'all want to check it out. But again, it's just basically a summary. A lot of times I'll bring up specific cases like last week, I think we talked about the gentleman down in the valley that had been fraudulently billing Medicaid. Week before was the couple out of Arizona that had built Medicare for $1.2 billion using advanced skin grafts for wound repair, which is another hot topic right now. There's another article, I didn't pull it up today, but there's some more advancements being made with these super high-tech bandages for wound care that are incredibly costly. So there's a little bit of summary for you. And then we've also got, this just came in this is on Be Insure, but you may remember that Humana, as well as other carriers, sued CMS for star ratings after they readjusted how they calculate star ratings. And they're like, hey, these new parameters that you're using to create star ratings, we don't like them. And they're causing us to see our star ratings drop, which is now going to cost us money because we're not going to get the bonus payments that we used to be getting when we were 4, 4.5, 5-star rating. Now we're down to 3 and 3.5 stars. But the court says, nope, sorry, Humana, you're still at 3.5 stars as far as some of these plans. And that was based on test calls that CMS was making to Humana, right? And it goes through here and it shows how they basically got them. It says, as part of a call center accuracy and accessibility study, CMS placed 3 calls to Humana, according to the initial complaint filed in U.S. District Court for the Northern District of Texas. It says in 2 of the calls, a disconnection occurred when an interpreter was brought on the line. So in other words, right, they're trying to get the interpreter on the line for a different language, and then Humana disconnects the call. That's certainly not good. In the 3rd call, the test caller incorrectly thought that they were put on a silent hold, but the representative was still on the line. So they're sitting there on the line with someone, but they're not talking. It's just silence. Humana said it did not follow up on the calls because the agency prohibited accepting callbacks for the purpose of the study. In other words, right, with these test calls that CMS was making, in the event that it's disconnected, like it was at least twice, if not 3 times, they don't have the ability to call that client back or that prospect back to continue the conversation or interview. And they're like, hey, that's not really fair, right? We're not giving us the chance to correct our call disconnections. Humana also asked the court to rule that the no callback policy was unlawful. But nope, they did not win. Pretty simple. So they are staying in a 3.5-star rating, at least for a good chunk of their plans that are out there. Certainly not all of them. There are some other Humana plans. I actually wrote one last week that is 4.5 stars. So it just depends on the area. But for the area that they were hitting them on, Humana did not win that lawsuit, man. So moving on, I want to show you this Kaiser Family Foundation study, and then we will jump into some bundling. Like I said, I already put this in the group. I'm not going to go through this entire study because it's fairly deep, but it is interesting. And one of the things I like about Kaiser Family Foundation is, number one, they do a really good job at kind of keeping their finger on the pulse of the health insurance world, and certainly the Medicare world. I've said this time and time again on this show. If you are an insurance agent in the health insurance space, whether it's ACA, whether it's Medicare, dual eligibles, I don't care, you should be following Kaiser Family Foundation and reading some of their reports and educating yourself, right, on the data that's out there, because you can always be able to use that to shape your marketing efforts as well as better serve your beneficiaries. Like this article, especially, like if you're a telesales group like we are, right, where you can really cherry pick and target certain areas that you want to market in, it's got some great data in it that we could easily use to target certain counties or certain areas where we know people might be struggling more because of plan exits or because of physician exits, et cetera. And we can better target certain marketing in those areas, et cetera. And then if you're an agent, working in a specified area, you're working in your local market because you like to see people face to face, or you got a brick and mortar, whatever the case is, you can use the data and then to learn more about your market so you can better serve it. But basically, this article again is talking about, or this study, I should say, is talking about access to physicians, and they're comparing traditional Medicare versus Medicare Advantage. And the claim is that people that are on Medicare Advantage, they have access to about half of the physicians that are available to traditional Medicare beneficiaries. And that alone is one of my biggest selling points that I use for folks when I am encouraging them within their budget to stay on original Medicare and pick up a Medicare supplement plan. Doctor access is one of the biggest selling points to it, right? If you're an agent out there, and whether you have great Medicare Advantage plans in your area or not, if you're not learning how to sell Medicare supplements and you're not using provider or physician access as one of your biggest selling tools, like, you're kind of missing the boat. 99% of doctors nationwide all accept Medicare, which means by nature, they're going to accept all Medicare supplements. They don't care who the Medicare supplement is with. It can be Aetna, it can be Humana, it can be Polish Falcons of America. They do not care, because ultimately that physician is just going to bill Medicare, and Medicare will handle the crossover payment with the Medicare supplement company. So again, this article is saying, hey, well, if traditional Medicare has access to 99% of providers in all 50 states plus Puerto Rico, Medicare Advantage gets access to, but they have about half of those doctors. And I would even argue it's probably less, because in many cases, they're not able to access doctors across the entire nation. They're able to access doctors in their area, right? So in a given area, right, let's say Travis County, I have access to 99% of the providers that are in Travis County, Texas, if I have a Medicare supplement plan. But if I have a Medicare Advantage plan, I'm certainly not going to get access to all of them. I'm only going to get access to the ones that are in my network, right? Whether it's HMO or PPO. So I'm going to show you some of the data that's in here that's pretty slick. And then, like I said, I've already put the article in the group. So if you want to dive into it a little deeper on your own time, certainly feel free. At the top, they drop some bullet points in here. Right, we're not going to get into those. I'm just going to show you some of the studies that they put together, or some of the reports that are in here, right? So again, this is kind of their basic concept, is saying the average Medicare Advantage enrollee only has access to about 48% of the physicians that are in that area, right? Whereas traditional Medicare, you're going to get access to basically 100% of Medicare doctors, which is 99% of all physicians. But here's where it starts to get pretty interesting. So in specific areas, and this is specific areas where they have some of the highest Medicare Advantage penetration, or the highest enrollment, right? So like Pima, Arizona is a very high Medicare Advantage penetration. And they're saying that, and this is one small issue with this study, and it's not a major issue, but the data is from 2022. So it is a few years old, right? So it might be a little different, but it's probably still very much in line with this. But in Pima, for example, where they have a high Medicare Advantage penetration, the average Medicare Advantage enrollee gets access to about 58% of the physicians that are in that area, if that makes sense, right? And then it goes on down the list, right? And again, they're specifically targeting some of the top counties that have the highest Medicare Advantage enrollment. I found this one at the very bottom, or the very bottom two, or actually look at all of California, truthfully. California has some of the highest Medicare Advantage penetration out there, but look at the physician access. Like in San Diego, it's terrible. Only about 18% of physicians in the San Diego area are included in a Medicare Advantage network. So as an agent, that tells me that if I'm marketing in San Diego, I should probably really be pushing Medicare supplement plans, because that's an 82% difference in doctor access. That is a point, like this data point is something that I would be using when I'm pitching my T65 clients, or any of my clients or prospects, on should I choose Medicare supplement or should I choose Medicare Advantage? Well, if you go the Medicare Advantage route, Kaiser Family Foundation says that only 18% of the doctors in San Diego are in a Medicare Advantage network. So you're going to lose access to 82% of the physicians that are in the San Diego area if you don't go with original Medicare and Medicare supplement. Los Angeles, just as bad, 22%. And we struggle. I mean, like, we got a very small percentage of people in the LA County area, because we do a lot of business in LA. It's one of our hot states and hot markets. We don't sell much Medicare supplement out there. It's higher priced. Generally speaking, a lot of the folks that we're dealing with are a little lower income. So to see that, it's a little bit disheartening to know that, hey, you know, when we're selling Medicare Advantage in these areas, they are losing a large chunk, a much larger chunk than I would originally thought, right? So Now, generally speaking, I will say in LA, we're mostly selling scan where they tend to have one of the better networks, but nonetheless, like this is super important. Like in Bexar, Texas County, which is San Antonio, it's right at 50-50. So this is some pretty good data here. You can even break it down even smaller. Where's this next one? Here you go. This is this is share of physicians that are included in enrollee provider networks. So kind of similar, right? Enrollees in large metro cities. I don't like that one as much. There's another one on here with specialist. Here we go. Now we're starting to get a little more detailed. This is a share of physicians in each plan offered in 30 counties that have, again, the highest enrollment. So in Hennepin, for example, you have a wide variety, and then it cruises down and it's going to get lower and lower for the different share of plans or share of doctors. They even have one on here for specialists. Star ratings, based on star ratings, right? 3 or fewer stars, they're only getting access to about 44% of physicians. The higher stars, even 5 stars, is 43%. Like, so star ratings don't seem to make that big a deal. Everybody's running pretty close to get about access to about 50%. Obviously, PPOs give you a little more broader access, but not that much. And that right there, that data point should tell you that if you have a PPO plan, that does not mean you can just go anywhere. Because if you have a PPO plan, then on average, you're only getting access to about 54% of the doctors that are out there. Well, why is that? I thought a PPO, they could just go anywhere. No, they can only go anywhere if it meets 3 conditions. Number 1, the doctor accepts Medicare. Number 2, he'll accept the terms and conditions of your PPO. And then number 3 is accepting new patients. Only 54% of doctors meet those 3 conditions. So there's another great data point to remind you that you can't just go anywhere when you have a PPO. They break it down by carrier, right? Blue Cross has the highest average access. About 59% of Medicare physicians across the largest Medicare Advantage counties, right? About 59% of them accept Blue Cross, 58% United Healthcare, Kaiser, 20%. So who's got the most physicians in their network? Centene is real high, 53%. This is all counties. The blue is the highest counties. So in the highest penetration counties, Centene's leading the pack at 59%. Outpatient specialties, right? Primary care, what is it? It averages 55% across all enrollees. In the 25th percentile, only 39%. In the 75th percentile, you get as high as 60%, 70%. Ophthalmology, super high. So different specialties will tell you, right? Ophthalmology has some of the highest penetration. Primary care, you're getting access to about 55% of national physicians. So pretty good data. Again, and like I said, my job is just to bring it forth to you, just like Kaiser's is. It's your job to follow it. It's your job to learn it and use it to execute and educate your clients better, to market better, right? And to kind of get a little more granular on that, let's go back to this San Diego example, right? San Diego, which has a high Medicare Advantage penetration rate. It's not the highest, but it's definitely one of them. But only 18% of doctors. Like if I want to run an ad in San Diego, I'm damn sure going to run some really cool educational ads on Medicare supplement products. And I'm going to use data like that in my metric. So that's where this data comes into play, is you can use it, again, not only to inform your customers better, you can use it to help inform you better, pick better products that are going to serve your clients' needs in these areas, and then certainly tailor your marketing to what that market conditions are like in that area. So there you have it. With that said, let's dive into some bundling. Some of you have seen this before, some of you probably haven't, and regardless, it's probably good for a refresher. This is a worksheet that I use. You do not have to use this worksheet. A lot of times I don't use the worksheet. I just write down the notes that are on this worksheet on a sheet of paper when I'm presenting a bundle. Again, a couple of key things. Number 1 is you have to, again, believe and understand that you're the professional. There's a reason they're sitting across from you, is because you have the license, you have the knowledge, you have the expertise to guide them. Do not be afraid to guide them and tell them what's going to work best for them. That's why they're coming to see you. They're not coming to see you so that you can dump all these different plans on them and then let them pick what they want. That's asinine. They're going to pick the wrong thing more often than not. So it's your job to sort through that information and then just tell them what's going to work best for them based on the answers and the intake that you've gotten from them. Okay. So one, it takes that level of confidence. And two, it takes you need to obviously understand how original Medicare really functions, because that's what the top half of this worksheet represents. And so when we are, and you can use this whether you're talking to T65s or whether you're talking to people already on Medicare, right? You may, for people that are already on Medicare, already enrolled in a certain plan, especially in the event that it's a Medicare Advantage plan, you may need to adjust what's on the top half based on that. The top half of my worksheet is based on original Medicare. So the way I'm presenting this currently for you guys is in the event that I'm talking to someone that is turning 65 years old. They are brand new to Medicare. They don't know anything about it, right? So what I'm doing is I've summarized at the top with some extra notes that I'm going to go in with you guys, how original Medicare works for them, what it covers and doesn't cover. And the blank area is where I'm going to write in my solution to all the holes that I just poked in original Medicare. And then the very bottom is the quote and the summary. Okay? It's not rocket science. I made the worksheet for people that, one, maybe don't have some of this info committed to memory and they want to use this. It works great. It looks professional, right? It looks like something we would do all the time with the client. But again, a lot of times I'm just doing it on a yellow sheet of paper. So if you know this script and you know all this data points in your brain, you can just do it right in front of them, right? And write it out right in front of them, which I've done many times. And then next thing you know, I'm writing 4, 5, 6 apps for somebody and taking good care of them. But we can use the worksheet. Now, again, like I said, I'm tailoring this to T65. You can do it whether you're pitching Medicare supplement bundle packages or Medicare Advantage bundle packages. The difference is in how you're going to write out your unique healthcare plan in the blank area for them. Okay? So I want to be really clear about this. Based on the worksheet, the way it's presented currently, this is a T65. The top half is Medicare, original Medicare, how it works, what the benefits are, and then we're going to poke some holes in that to make sure they understand what their exposures are. The second half, the blank area, is where we're going to write in our custom solution. And then the bottom half is we're going to total it up and give them a drive out price. And then a couple of key questions. So pretty simple. So I'm going to go through it with you guys from top to bottom. This is exactly how I would present it. Okay. Some of the things that I'm going to say would be what I would be writing next to this, right? So in many cases, this is someone I've already had a few conversations with, right? Because I marketed to them 9 months ago before they even turned 65. I built that part of the relationship, started building the rapport, started some discovery, realized, okay, when this person turns 65, they're definitely going full Medicare. Let me get some of that education process going. Let me find out what their desires and needs are when it comes to Medicare. Let me find out if they're going to have to deal with IRMA or late enrollment, any of that type of stuff. Like, let me get all my brain wrapped around them. And in the event that you have someone, especially in a like one of the real keys why this works great in a telesales space, even though you have to make them get a pad and paper and write some of the stuff down, is because you're, on a lot of cases, you're going to be able to use your 48-hour scope of appointment regulation in your favor, because you'll be able to go out and get all your information that you need from them and then say, perfect, Betty, I've got everything I need now. I just need some time to dive into this and do my due diligence so that I can put together some options for you. And then you just set your appointment for a little more than 48 hours later, right? And that's a great way to do that. And then you can come back and boom, cool, Betty, let's go. I've got my notes, grab a piece of paper, and I have some things I want you to write down. Otherwise, if I'm doing this face-to-face, I'm just going to pull out this worksheet or work through it right with them. But nonetheless, next to Medicare Part A, I'm going to remind them, hey, Betty, pretty simple. I just want to go back through and make sure you understand how original Medicare works now that you have your red, white, and blue card. Okay. I want to make sure you understand exactly how that works. As we've already learned in some of our discussions, Betty, Medicare Part A is no cost to you. So next to Medicare Part A on my worksheet, I would either write no cost or I would write a 0 with a $sign. Do not write the word free. Free is verboten in the Medicare space. You're not supposed to be saying, oh yeah, Medicare A is free, or oh yeah, this Medicare Advantage plan is free. Don't use that word. So next to Medicare Part A, I'm either going to write no cost or I'm going to write 0 with the $sign. It's $0. Now, we've also learned, Betty, that Medicare Part B is not free. And as we've discovered, you're going to pay $185 a month for that. And then next to Medicare Part B, I'm going to write $185. $sign 185. And now as a reminder, Betty, when you have A and B at $185, that's going to give you that 80-20 plan. So you can go see any doctor that you want in the nation that accepts Medicare. Generally speaking, Medicare pays 80% of the bill. You're on the hook for 20%. And what's most important to understand, Betty, is that 20% is uncapped. And I will write in all caps the word uncapped next to 80-20 plan. It's an uncapped 20% coinsurance. Now that hits fairly well, but I also want them to understand how that 20% looks like in a real world scenario. Because if I just tell them, hey, you're on the hook for 20% and it's uncapped, they're like, okay. And some of them, they'll get it. They're like, oh, shoot, 20% of a heavy medical bill could be a lot of money. Like some of them will immediately snap and some of them are like, 20%? That doesn't sound bad. Like, right, well, let me make sure you understand how that looks like in a real world scenario. So when you're looking at the worksheet, right underneath 80-20 plan where I wrote uncapped next to 80-20, I'm going to write down some costs of what 20% looks like in real world scenarios so that they can then get a realistic perspective of what they're on the hook for when things happen, because things inevitably will happen. So that's where those little sub indexed points are. Doctor visit. How much does a doctor visit cost someone if they're on original Medicare? On average, it's about $50. How is that? Well, the average doctor visit's about $250. Medicare is going to cover 80% of it. You're on the hook for 20%. 20% of 250 is 50. Not a big deal having to pay $50 for a doctor visit. It's not terrible. But what's a hospital stay? Now, you might want to look up some of the data specific in your area, but I can tell you that in Texas, the average hospital stay is 3 days and it's a little over $15,000. So now my 20% is looking closer to $3,000. And next to hospital stay, I'm going to write $3,000. Right? These numbers that I'm writing down is their out-of-pocket exposure. Critical illness, right? So I've already hit the hospital is average of this. You're looking now at like a $3,000 out-of-pocket cost. But if you have a critical illness like cancer, heart, or stroke, you can only imagine that your 20% is going to be a lot more expensive. Now we're looking at 5 figures, maybe even $15,000 to $25,000. And I'm going to write out $25,000. Now, skilled nursing is a common thing that a lot of people are concerned about. Now, Medicare is going to give you skilled nursing. They're going to give you 20 days at no cost. So I'm going to skip the skilled nursing line. I'm going to come back and put out how much skilled nursing costs. Medicare is going to give you 20 days at 0 cost. Again, I'm not going to say free, but I'm going to put a 0 with the $sign next to 1 through 20 days. 21 through 100 days, they're not going to give you free. You're going to have a $209.50 copayment per day. And I'm going to write that out next to 21 through 100. $209.50 per day. And then in the event you need more than 100 days of skilled nursing, you would have to pay all costs. So next to 101 plus, I'm going to write in all caps, all costs. And this is where I circle back to the skilled nursing line to write $100,000. Because you can do some simple research to find out that skilled nursing care is about $100,000 a year. And most people kind of already know that sitting in a nursing home for a year is super, super, super expensive. It's why that we sell things like long-term care, or in the case of the bundle I'm about to show you, short-term care. Okay. So again, I'm going to run through that real quick. I'm going to write out Medicare Part A is $0. Medicare Part B is $185. That gives you an 80-20 plan. What's most important to remember, Betty, about that 80-20 plan is that you have a 20% coinsurance that's uncapped. So there is no maximum threshold on it. And to give you an idea of what that looks like in the real world, a doctor visit's not a big deal. 20% of a doctor visit, you're looking at about $50. Now, a 3-day, the average hospital stay in Texas is going to be about $15,000 over 3 days. So now your 20% looks like $3,000. Now, if we have to deal with a critical illness or something like cancer, heart, and stroke, you can only imagine your costs are going up. Now your 20% is starting to look like 5 figures, $15,000, $20,000, $25,000. And I'm going to write $25,000 next to critical illness. Now, skilled nursing is a whole nother thing. The good news is Medicare is going to give you 20 days at no cost. So in the event you need to be put in skilled nursing for some rehab or recovery, you'll get 20 days at no cost. If you need more than 20 days, they will give you another 80 days, but you have to pay $209 per day. And I'm going to write $209 per day. In the event you use more than 100 days of skilled nursing, you would have to pay all costs. And I'm sure you already know that spending a year in skilled nursing is about $100,000 a year. And I'm going to write $100,000 next to the word skilled nursing. So now I've explained how much Medicare cost them. 0 for Part A, 185 for Part B. And I've shown them how much it will cost them in the real world when they use their 80-20 plan. You'll notice there's 2 more spaces on there, one for drug coverage, one for dental, vision, or hearing. Guess what? Medicare gives you no coverage, so I'm just going to put an X next to that for drugs, and they don't include dental, vision, or hearing. X. So that, everything that I've just explained to them is what that red, white, and blue card gives them, right? So this is what that gives you. Obviously, it's got some gaps in it. What I can do, and I circle, if I'm in front of them, I'm going to circle everything that I wrote out, one giant circle across the top half of the sheet. What I can do for you, Fred, is I can take all of this and turn it into this. And then I'm going to write my notes for my custom healthcare package in the blanks. And that would sound something like this. Fred, here's what I can do. I can take all of this at the top, and I'm going to make, instead of having a wide open 20% coinsurance, we're going to reduce that to a $257 annual deductible. And that deductible is generally going to be for doctor visits. So when you go to the doctor, right, anytime you visit the doctor throughout the year, the first $257 is on you. In the event you have more doctor visits after you meet your deductible, it's only a flat $20. Pretty simple, right? But you're going to have 100% hospital insurance. So in the event you are hospitalized, you will have no deductibles. You'll be fully covered on day one. So again, instead of having a wide open 20%, we're going to reduce that to a $257 deductible with 100% hospital coverage. Now, as you noticed, Medicare doesn't cover your drugs. So I was able to get in drug benefits for you, including the prescriptions that you're taking. I've got a simple plan that'll allow you to go to your favorite Walgreens pharmacy, and it's going to cost you, and I'm going to use an arbitrary number in this case, about $54 a month for your plan plus your prescriptions. So you'll be able to get all your drugs filled at your favorite pharmacy. Pardon me. In addition, instead of only getting 20 days of skilled nursing, what I'm going to do is I'm going to increase it to 460 total days of skilled nursing. And not only am I going to do that for you, Fred, but we're going to give you the option that if you need, you can have that skilled nursing done in your home instead of in the nursing facility. If you want, we'll have the nurses come to you. So we're going to include that in your healthcare package. And then finally, I've got $1,500 in dental with a wide provider network. Fairly simple. That's even a kind of a small bundle. All I'm selling there, I'm selling a Medigap plan, a drug plan, a home healthcare plan, and some dental insurance. That's 4 applications. Pretty simple. Okay. And again, I'm just writing this out in the blank area. So again, I want to do this real quick again for you. So I've already summarized Medicare for them. Part A is no cost. Part B is $185. That gives you an 80-20 plan that's uncapped. In the real world, doctor visits probably $50. Hospital stay is about $3,000 co-insurance for you. Critical illness, now we're looking at about $25,000 out of pocket. Skilled nursing is about $100,000 a year. Medicare is going to give you 20 days. The average Medicare beneficiary needs 37. So when you go past 20 days, you're going to have to pay $209.50 per day. If you happen to use more than 100 days of skilled nursing, you have to pay all the cost. I've already told you that's about $100,000 a year. And unfortunately, Medicare doesn't give you drug coverage, dental, vision, or hearing. So what I'm able to do, Fred, is take all of that, and I'm going to turn it, instead of having a 20% wide open co-insurance, we're going to do a $257 annual deductible that is paid in piecemeal as you visit the doctor. After you fulfill your deductible, if you have more doctor visits in the same year, they're a flat 20% or a flat $20. But good news is if you're hospitalized, you'll have no deductibles. You're covered 100% in the hospital from day one. I'm also able to get in drug coverage that will allow you to fill all your favorite prescriptions at your favorite Walgreens. So we've got that included. And I even have $1,500 in dental included in your healthcare plan. And then finally, instead of just 20 days of skilled nursing, we're going to give you 460 days of skilled nursing that's convertible to home health care instead of just having to go to the stale nursing facility. You can have the nurses come to you. That's pretty much the description of my healthcare package for the most part. In there, I might remind him that he still gets access to 99% of providers all across the nation, all 50 states plus Puerto Rico. I didn't reduce his provider network. Now, at the bottom, I'm going to total up his cost. My health plan cost would be the cost of my plan in Medigap that I just mentioned to him. It would be the cost of the drug plan plus the monthly cost for prescriptions, right? When I put an estimated RX costs, right? So that's premium plus expenses. So if it cost them $54 to go get all their prescriptions plus their $0 WellCare plan, for example, I'm going to write that next to estimated RX costs. But next to health plan cost, I'm going to write the total premium for everything that I'm including, which in this case would be my Medigap plan in, my home healthcare plan from United National Life that I'm including, and then the dental plan probably from Emeritus or maybe Delta that I'm including. I'm going to add all 3 of those up and put them under health plan cost. And then RX cost is the total cost for his scripts. Part B, I'm just bringing that down from the top, $185. You add it up, you get total monthly expense. Now, in Texas, and most states technically, with a few exceptions, I can get this bundle built for less than $400 a month. And that includes their Part B premium. So if you have people that are on group insurance and they're moving over to Medicare, in your brain, you should be using what they were spending on group as kind of a budget threshold. Granted, when they retire and they move to Medicare, they're probably not making as much income. So maybe, that group price isn't as affordable as it used to be, but their brain is already kind of calculating that. Well, shoot, my group was charging me $550 a month to be on their plan, right? $225 every 2 weeks they would deduct from my paycheck, or $275, whatever that is. And I can use that as understand, like, okay, this guy's used to paying about $500 a month. So if I can get it under that. And I'll tell people that when they're asking, well, how much does Medicare cost? I'm like, well, it ultimately depends on your unique situation. But what I tell most of my clients in Texas is that including your cost of Medicare, like I can usually get you excellent benefits and great coverage for less than $400 a month. Because my Medigap plan in Texas is $78 for a 65-year-old female, a little higher for the male. My home healthcare plan that I pitch is about $50 a month. Depending on their scripts, like that's where a big part of it's going to play. Depending on their prescriptions, I might be able to get them the $0 WellCare plan. And if they're only taking generics, well, that's still $0 cost. But if they are taking some scripts, like yesterday, I wrote a guy the $0 WellCare plan as part of his package, but he had one script that was going to cost him $38 a month. So I would just write that $38 a month in there on next to RX cost as an example. And then finally, the dental plan, $1,500. That's Emeritus. That's about $26. So in this case, I'm looking at what 120. I'm looking at about $150 in premiums as a soft example. Add that to 185, and I'm at $335 drive out price. Most people, not all, most people can afford $335 a month for their health care, especially knowing how great that package I just designed him is. And if you weren't quick enough to follow along with what I gave this guy in this example, I wrote him a plan in Medicare supplement so he can go to any doctor he wants in the nation, no referrals, no problems. Those are other notes that I would write, right? Hey, what we're going to do is take this and I'm going to turn it into a $257 deductible without reducing any of your provider access. So you'll still be able to see 99% of the doctors that all accept Medicare. You won't need referrals. You don't need anybody's permission. All you need to find out is, hey, do you accept Medicare and do you accept new patients? Cool. Book me an appointment because I'm coming in. Right. So I gave him a plan in. He can see any doctor he wants in the entire nation. No referrals, no issues. He's got $1,500 in dental. He's got a drug plan that covers him, and he's got an extra 360 days of short-term care, skilled nursing. Alternatively, I might do that a little different. I might say, hey, maybe I don't like to sell the home healthcare product. Maybe it's not as fancy in my state or whatever it might be. Maybe my shtick is selling cancer. So I can take that same bundle and be like, hey, what I'm going to do is give you similar deal. We're going to maintain your access to 99% of doctors. I don't want to reduce your provider access. But instead of having a 20% wide open coinsurance, we're going to reduce it to a $257 deductible. We're going to include drug covers that allows you to go to your favorite Walgreens over there and get all your drugs filled. I've got $1,500 in dental benefit that we're going to add to it. And it even includes a $20,000 lump sum cancer benefit in the event that you get cancer, or when you get cancer, right? Not if, but when you get cancer, they'll just pay an extra 20 grand cash money, spend it however you want. I have all that included in your healthcare package. As we already know, Part B is $185. This healthcare package is going to run you $315 a month. Or this healthcare package, I'm sorry, is going to run you about $150 a month. Add that to your $185, you're looking at about $335. Fred, does that sound like the type of healthcare that you would feel protected by? Yes. Fred, does that fit your budget? Yes. Perfect. I just got a little bit of paperwork to do, and we'll have you out the door in no time. Piece of cake. I just wrote Fred 4 apps, and he's super happy about it. Now, is Fred ever going to let anybody else come behind me and change his healthcare plan? I want to use that Homer Simpson meme with the... No, he's not. He's not going to let anybody in the door to come mess up any of this stuff that I built for him, because he's got a dope custom healthcare package that the expert down the road designed for him. And he's not going to let anybody come mess it up. Because even though all of these pieces that I built for him are interchangeable, he can change his Medigap plan without affecting the rest of the package. He can change his drug plan without affecting the rest of the package. He can change the dental plan or the cancer plan without affecting the rest of the package. In his mind, any tinkering could mess up the whole package. So he's going to leave it its own. And if he does have questions, guess who he's going to come back to? He's going to come back to me. Hey, I need to make some adjustments to my package. No problem. Let's get you fixed up. One of the analogies that I try to use when I teach people about Medicare and help them understand the original Medicare side of the fence versus the Medicare Advantage side of the fence. If some of you are old like me, you might remember the old rack stereos, the big ones, right? Tower speakers, cabinet, glass door, the whole bit, right? And you would go and the real audiophiles, the real geeks, they would buy, the high-end Onkyo receiver. Boom. Then they'd go get the Techniques digital equalizer. Boom. Then they'd buy their cool Nakamichi double deck reverse super tape deck, and then a turntable and CD player and a DVD player. And they built everything unique, fashioned out of the best items they could get. That's original Medicare, right? I can individually pick all my components to build my healthcare package, my rack stereo, the way I want. Alternatively, there was always that cheap guy that's like, nah, just give me that all-in-one box by Sanyo. I want that one. And then if the tape deck breaks, well, basically the whole thing's junk. That's a Medicare Advantage plan. Everything's built into one box. If any piece of the box breaks, the whole thing is pretty much worthless at some level, right? So that's a great analogy, especially for a lot of the old folks, because they remember all these boomers that we're talking to. They had rack stereos, a lot of them, or they had the Sanyo all in one box. And I will use that to help agents understand both sides of that fence. Now, getting back to this, I can do the exact same thing with the Medicare Advantage plan bundle. My words are just going to be different. The top half doesn't change, right? So if in my intake, discovery, right, my needs analysis and my conversations with them before time of sale, I've discovered that this person is likely going to want a Medicare Advantage plan because they've already kind of told me, because I have questions in my discovery needs analysis that determines that, right? I'm listening for those things. Budget, I'm listening for desire to have access. I travel, so I'm always around. Like I'm listening, I'm picking up key items to know what I believe is going to perform best for this person. If they tell me they're a snowbird and they spend half the year in the north and half the year in the south, I'm damn sure not going to pitch them a Medicare Advantage plan. I'm going to pitch them a Medicare supplement package. But if they tell me in speaking with them that they're okay using network plans, they don't really go anywhere, they're fine with the network plan, they're used to network plans, and they don't mind saving in premium dollars to have a pay-as-you-go type situation. Okay, well, this person's going to gravitate towards Medicare Advantage. And assuming I have all the data, right? I've got their doctors if they have any. I've got their prescriptions if they have any. I've done all that due diligence so that I can properly, at an educated level, show them their package and what it's going to cost them. So if I have someone where I really feel confident that Medicare Advantage plan is going to be what they prefer, it's what they're asking for, then I'm going to build it that way. But my language when I get to the custom side is going to be a little different. So again, everything else is the same. Medicare Part A, Fred, we've already discovered Medicare Part A is no cost. Medicare Part B, $185. That gives you that red, white, and blue card. You have an 80-20 plan now. You can use it anywhere you want, but you have a 20% uncapped coinsurance. 20% may sound like a lot, but let's put it in the real world numbers. A doctor visit, 20% is about $50. That's your $50. A 3-day hospital stay, however, now your 20% looks closer to $3,000. In the event you contract a critical illness like cancer, heart, stroke, now we're looking at 5 figures, $20,000, $25,000. Again, this is your out-of-pocket exposure, et cetera, et cetera. So I'm going to go back through that, and then I'm going to circle everything that I wrote at the top. Now, what I can do, Fred, is make it look like this. What I can do is I can get you in a health plan that has no deductible. It's going to start day one. So instead of having a wide open 20% coinsurance with deductibles, I have an option that's no deductible. Your plan will pick up right immediately. I'm not even going to bother telling them it's zero premium because I don't need to. I'm just going to tell them, hey, it's no deductible. It's going to allow you to see your favorite doctors at zero copay. Your primary care physician. Now you will have a $25 copay for your specialist that you told me about. And then you will have some co-insurance for hospital visits and other things. But the good news is I'm able to build in a cap for the maximum you spend. So whereas above is a 20% uncapped co-insurance, we're going to turn this into a zero deductible plan with some minimal co-payments, but has and I'm being arbitrary, that has a $3,700 maximum out of pocket for the year. So worst case scenario, if you had a couple of hospital stays and a few other things, the most you would have to come out of pocket would be $3,700. However, I was able to build in a reimbursement indemnity option that will pay you back for hospital stays, a cash benefit. So anytime you stay in the hospital, all you got to do is turn in your claim and they're going to give you a cash benefit back, right? And I was able to include $20,000 in cancer coverage, a $1,500 dental benefit, and you get $200 in eyeglasses every year. And I'm kind of arbitrary off the cuff a little bit, but basically what I just presented him was a Medicare Advantage plan with a cancer policy is really all I got there, because the Medicare Advantage plan includes drugs, includes vision, includes dental, and I'm just hitting the high level benefits of it. And then I threw in 20K in cancer as an example. So that's a little short. Oh no, I'm sorry. I have a hospital indemnity in there too. Sorry, I forgot about that because I mentioned the cash reimbursement for the hospital stays. So that's a 3-app bundle probably, right? 20K in cancer, which sometimes can be a rider on my hospital indemnity, right? I can actually do a $20,000 rider on my hospital indemnity plan with UNL. If I'm going to sell that much, I would usually rather bounce over to Mutual Omaha and get them a much better rate. But that's for me to decide at that point. But that'd be another example of how to bundle. The key is you got to come up with the language to present your plan, right? Now, some of you are out there like, wait a second, he's selling them a Medicare Advantage plan and he didn't go through the summary of benefits. Well, not yet, because I haven't done the enrollment yet. All I'm doing is I'm telling them how their plan works for them, the package that I've designed. Once they decide, yes, they answer my 2 questions. Hey, does that sound like the type of healthcare that you want or that you would feel secure and safe with? Yes. Cool. Does that meet your budget? Yes. Perfect. I just have some paperwork to do. When I'm doing that paperwork, when I'm doing the enrollments, that's when I'm going to go through the summary of benefits with them on the Medicare Advantage enrollment, line item by line item, right? Fairly simple. So I'm going to keep, I'm going to dot my I's and cross my T's. Pretty simple, but it's the exact same concept. Hey, Fred, here's what I can do. I can take all of that, and instead of leaving you in a plan that has a 20% uncapped coinsurance, what I'm able to do is put you in a no deductible plan. So it starts day 1. And instead of being a wide open 20% coinsurance, we're going to break it down into small copayments and then put a $3,700 annual cap on it. Those copayments are simple. It's $0 to see your primary care physician. You'd pay $25 as an example to see a specialist. And you're looking at $325 a day for 5 days in the hospital. But our plan also includes a reimbursement option. So when you are hospitalized, you'll just be able to turn in your claims and they'll actually pay you cash back for those $325 per day in the hospital. Pretty simple, right? It includes $1,500 in dental or whatever my dental benefit is. It includes $200 in eyeglasses as an example. Like I'm just giving them some of the fluff that's in it. And then when cancer or critical illness strikes, it's actually got a $20,000 lump sum benefit for cancer, heart, and stroke. So when the time comes and you are diagnosed with cancer or you have a heart attack or you have a stroke, it's going to pay you $20,000 cash that you can use to help get the type of treatment that you want, right? And help you cover some of those index costs. Now, and then all of this will still allow you to see all of your favorite physicians you already told me about and get your drugs refilled at your favorite Walgreens. And just so you know, I did the cost analysis. It's going to cost you about $33 a month to get your drugs refilled every month. Pretty simple. So my health plan cost would be this, right? Under the summary at the bottom where I total it up. Well, it's a 0 premium Medicare Advantage plan, probably. The hospital indemnity plan that I'm including in there is maybe $50. It's probably cheaper than that, to be honest with you. That's probably about a $35 to $40 hospital indemnity plan. I'm adding 25 or 20,000 in CHS or CHAS, critical illness, cancer, heart, stroke. That is probably about $60 a month. And then everything else is included. So I'm basically writing a $95 premium, right? 35 for the hospital indemnity, another 60 for a fat lump sum cancer policy. So I'm going to write my health plan cost is $95. I've already told you that your RX cost is $33. Part B, we just pulled down from the top, is $185. So 95 plus 33 plus 185 is $300. Yeah, about 300 bucks. Total monthly expense, $300. Does that sound like the type of healthcare plan that would keep you safe, Fred? Yes, it does. Excellent. Does that fit your budget? Yes, it does. Cool. I just got a little bit of paperwork and we'll have you out of here in no time. Like, that's not a hard bundle script. It does take a lot of confidence though. And it takes knowing your products. And if you want to start cross-selling better, that's the way to do it. Like, that is the best way. The best time to try to cross-sell somebody is when you already got them on the phone, when you already got them in front of you, right? Some of my previous shows the last couple of weeks, I've been talking about cross-selling post-sale, which still isn't hard. Not hard at all. You just have to do it. You have to bring it up. This is just another way to bring it up right at point of sale. Excellent worksheet. So, I mean, if you're out there and if you're an agent that's in the brick and mortar space, or if you're running home appointments or having people meet you somewhere to run appointments and you're not doing something like this, you're missing the boat, because you could easily, with a simple presentation like that, average probably 3 to 5 apps every single sale. Every time. I guarantee you, unless you're just doing it wrong. But every Medicare Advantage plan, if you did it that way, every single Medicare Advantage plan you sold, I guarantee you would at least get a hospital indemnity plan. And if you're really good, you might get the hospital indemnity plus a home health care package. As an example, it'll get you 3 really strong apps. In the Medicare supplement world, same idea. You should be getting the MedSup, the drug plan, a dental plan, a vision plan, and some cancer, heart, stroke, or a home health care plan. That's 5 apps. It's not rocket science. It just takes some confidence. It just takes the willingness to ask. Because what's the worst thing they can tell you? No. You heard that before, haven't you? You had someone tell you no yet? You probably had a whole shitload of people tell you no, because that's what most people tell you. So don't be afraid to ask for things that give people a chance to tell you no, because you hear that already. The worst thing they can tell you is no. That's too much. That's not in my budget. No problem. Let's trim it down. If I had to get rid of anything in here, Fred, what would it be? Do we need the dental insurance? Is that important to you? We can throw that out. That saves you $26 or whatever it might be, right? Whatever it might be, you can trim it down. So that is the thing. If anybody wants a copy of this, I mean, it's an easy worksheet. If anybody wants a copy of it, let me know. It's not hard. And if you're a genius at Medicare, you should already know these costs and in your brain where you could just write it out. But if anybody needs a copy of that, feel free. Give me a holler. I'll shoot it over to you. Other than that, man, that is the training for today. Another big banging day here at Go Ovula Brokers. We had a smoking day yesterday. I even made a joke that we had a new problem in our business, is that walk-in traffic was starting to disrupt telesales operations. Because most of our business is done by phone. We market in 35 states, but we do have a nice office here, and we do have local people coming to see us from time to time. And we're getting a lot more of that this year. The people that came in yesterday said they found us on Nextdoor. I don't do anything on Nextdoor. I think Grace might have made a couple of posts on Nextdoor. But our Google profile is starting to pop. We've got about 120 5-star reviews, something like that. So people are starting to find us, and they're just starting to walk in these doors and be like, hey, we need help with Medicare. So if there's any problem that we have over here, we need more people, more agents. We got leads coming up the wazoo. So anyway, that's the training. That's Tuesday. I will see y'all next week for some more stuff. Give me a holler if you need something.